Okay, hi and hello everyone. My name is Mohd bin Hashimi, and today I will present to all of you about exercises induced compartments. Okay, what we learn is about what is exertional compartment syndrome, causes of compartment syndrome, the symptoms, and the risk factor, and also for sure, lastly, is the conclusion. What is exertional compartment syndrome? Okay, chronic exertional compartment syndrome is an exercise-induced muscle and nerve condition that causes pain, swelling, and sometimes disability in the affected muscle. Okay, this compartment syndrome is affecting the muscle and also the nerve. People typically experience pain after a period of high-intensity activity or exercise, and it is quickly relieved by rest. Okay, the pain can be quite painful, and for sure it can limit the individual activities level. Okay, different compared to acute compartment syndrome, which need a surgical emergency. Okay, acute and chronic is different, which acute need an emergency treatment. Causes of exertional compartment syndrome. Okay, guys. Okay. Exercise-induced compartment syndrome is due to a pressure built up within the muscle. Okay. During the strenuous activity, the volume and weight of a muscle can increase by about 20% in size. This is a result of the muscle fiber swelling to 20 times their resting size during this period of strenuous activity. Okay, we can refer to this picture. Okay, as we exercise, we are doing activity, for sure our muscle will get bigger, and the compartment syndrome will occur, which which the blood vessel and the muscle will block the nerve and the artery. When the fascia is too tight and it constricts the muscle during this episode of strenuous activity. Okay, want to know what is fascia? Okay, we refer to the next slide. Okay, the fascia is this four: superficial posterior compartment, deep posterior compartment, the lateral compartment, and the anterior compartment. Okay, compartment syndrome mostly occur in the lower leg, which is in this part, compared to the arm, because most of us we're running using our leg, right? Okay. As the muscle expands and becomes constricted by the fascia, the blood flow to the muscle is interrupted. The lack of blood flow causes ischemia. Okay, what is ischemia? Ischemia is an insufficient supply of blood to oxygen, which usually due to blocked artery. Okay, and ischemia is occur at the myocardial of our heart, which can cause heart attack. The symptoms: itching, burning, or cramping pain in a specific areas, for sure at the four compartment syndrome as I explained before. Tightness in the affected limb, numbness or tingling in the affected limb, weakness of the affected limb, and it often occurs in the same compartment of both of our leg. If it happens in the right leg, and our left leg will also feel the same. The treatment: for sure in a period of rest, avoiding any activity that cause the system, and such as vigorous activity such as jogging and cycling and running. And if the diagnosis of Common syndrome is clear and the symptom persists, then surgery may be needed, and it will not be chronic, and for sure it will be an acute compartment syndrome. Conclusion: chronic and acute exertional compartment syndrome isn't a life-threatening condition and usually doesn't cause lasting damage if you get appropriate treatment. However, pain, weakness, or numbness associated with chronic exertional compartment syndrome may prevent you from continuing to exercise or practice your sport at the same level of intensity. That's all from me. Thank you guys.